If someone in my family was facing surgery tomorrow, my parent, my sibling, or my child, here is what I would sit down and tell them. Not what the hospital leaflet says, not the consent form language, not you will be fine, don't worry. I will tell them what I know after 15 years as a surgeon and another career as a psychiatrist about what actually helps a person go through surgery well and recover well. Because in all my years in operating theatre across India, the UK, and the United States, I watched patients prepare their bodies meticulously and completely forget about their minds. Blood tests are done, fasting done, pre op assessment done, but the mind just left to fend for itself. And I am here to tell you that is a significant mistake. Not a moral failing, just a gap that nobody filled for you. So today, I want to fill it. My name is Dr. Uttam Shiralkar, surgeon for 15 years, psychiatrist after that. Now I work as a surgical performance coach and mind-body therapist for cancer and surgical patients. In the last two videos in this series, I told you about what happens in a patient's mind when surgery goes wrong psychologically and what happens inside the surgeon's head when things go wrong technically. This video is different. This one is, what do you actually do? Here is something I noticed very early in my surgical career. Two patients could arrive on the morning of the operation in completely different psychological states. One, settled, not without nerves, but settled, grounded in what was going to happen. The other, visibly terrified, clenching the bedsheet, answering questions in monosyllables like yes or no, that's it. And the interesting thing was, their physical health was often similar. Same age range, same fitness, similar diagnosis. The difference was almost always in what they knew and what they had done with that information in the days before. The settled patient had asked real questions and gotten honest answers. The anxious patients had avoided the conversation, hoping the fear would somehow go away on its own. It never does. And we now know with good evidence that patients who receive psychological preparation before surgery have less pain afterwards, shorter hospital stay, low rates of complications, and recover faster. Not by magic, by biology. Reduced cortisol, better immune function, better sleep, better wound healing. So, this is not soft advice, this is medicine. The first thing to do, and do this early, not the night before, is get a realistic picture of your recovery. Not everything will be fine. A real picture. Ask your surgeon or their team members what day 1 typically looks like after the specific procedure. What about day 3, day 7, the first 2 weeks? Ask what normal discomfort feels like after this operation. So when you experience it, your brain files it as expected rather than catastrophic. Because here is what happens when nobody tells you this. You feel the expected pain on day 2, and your brain, which has been fed nothing but reassurance, interprets it as evidence that something has gone terribly wrong. And that belief, that fear amplifies the pain further. It is a cycle, vicious cycle, and it is entirely preventable. Now the second thing. The second thing, and this one is for families too, is to brief the people around you. Your family will be anxious as well. That's natural. But anxious families say anxious things, and patients absorb every word. Sit your family down before the surgery. Tell them there will be pain, there will be fatigue, there will be probably 1 or 2 days that look worse before they look better. That is normal. That is healing. When they know that, when the dip on day 2 doesn't frighten them, it doesn't frighten you either. Now here is the part that tends to surprise people. In the week before surgery, there is something genuinely useful you can do every single day that tells about 10 minutes. That takes about 10 minutes and has real clinical evidence behind it. Breathing. Not complicated, not yoga, not anything requires a class or an app or special mat. Just deliberate, slow, controlled breathing. In for 4 counts, hold for 2, out for 6. That's it. Done daily in the week before surgery, this reduces cortisol level, lowers blood pressure, improves sleep quality, and shifts the nervous system away from its threat response. And that matters in surgery because a body that goes into theater already in a state of chronic stress, elevated cortisol, disrupted sleep, tight muscles, poor circulation, is genuinely harder to operate on, slow to respond to anesthetic optimally, and slower to heal. Some hospitals now offer what is called as psychological prehabilitation, not rehabilitation, prehabilitation. 1 or 2 structured sessions with a psychologist or a trained nurse before a major procedure. The results are striking. Less postoperative pain, less anxiety, shorter stay, and fewer complications. If you know any hospital offers it, take it. Seriously, if they don't, what I'm describing here is the DIY version of the same thing. The day before surgery, keep it quiet if you can. Not numb, not distracted, quiet. Don't spend the evening reading about your procedure online. I promise you. Whatever you find on internet at 11 o'clock the night before your surgery will not help you. If something is worrying you, one specific thing, write it down and bring it with you to the hospital. Ask it in person. Get a real answer. This is so much better than 3 hours of worst case scenario reading on internet. The morning of surgery, this might sound simple, but it matters enormously. Tell yourself something true and grounding. Not everything will be definitely perfect, but something like, I have prepared as well as I can. I'm in good hands. Whatever comes, I can handle it. This framing, realistic, not falsely positive, actually activates a protective psychological state. It is the placebo effect properly used. Most preparation guides stop at the operation, but the recovery period is where psychological preparation matters perhaps even more. Give yourself full permission to feel terrible on some days. Permission to be irritable, tired, emotional, slower than you expected. Surgical recovery involves real trauma to the body. Hormones fluctuate, sleep is disrupted, pain is exhausting. Feeling low or anxious in the first week after surgery is not weakness. It is biology. But if these feelings persist, if by 3 or 4 weeks out you are still not sleeping, still gripped by fear, still not yourself, please say something to your surgeon, to your GP, or someone, because post-operative anxiety and depression are real. They are common and they are very treatable. They are not a permanent state. They just need to be acknowledged. What I have just described, the questions, the family briefing, the breathing, the realistic expectations, the permission to struggle afterwards, none of this is complicated. None of it costs money. None of it needs a referral. It just needs someone to tell you. And for too long, that conversation has not been happening in enough operating theaters, in hospitals, or enough in clinics. So if this video has given you one thing to do differently before a surgery, yours or someone you love, then it has done its job. In the next video, I'm moving to completely different territory. We're going to look at mind-body medicine in 2025. The therapies people are spending billions on, the claims being made online and in wellness culture, and what the actual science is, what works, what's hype, and what is quietly doing harm. I'm Dr. Uttam Shiralkar, surgeon, psychiatrist, and surgical performance coach. See you in the next one.